Okay, everybody come back in the room. Come back in the room, everybody. Come on, guys. Come back in the room. Let's go, let's go, let's go. Welcome to the live. Welcome to the live. Everybody jump back in the room. Okay. We're notifying. All right, let everyone know that we're back in the room. Okay, everyone. Okay, guys, come on back in the room. Come on back in the room. We're back in the room. We're back in the room. Okay, are you guys? Come on, guys. Come on. Come, let's go. Jump. Let's join. Let's join. Let's go. Come on, everybody. Come back in the room. Come back in the room. Hi. Hi, everyone. Hi. Let's go. Let's fill the room back up. Let's fill the room back up. Let's go, let's go, let's go, let's go. I don't know what was going on with the last live. Hi, Ruby. Hi, guys. How are you? Hi, Grace. Full, how are you? All right, guys. I don't know what happened. That's right. Let's keep them hearts going. Let's keep them hearts going. But as I was saying that, what you guys want to do, I hope everyone can hear me clearly. Can you guys hear me clearly now? Hi, Graceful. Thank you for coming back in the room, my love. I don't know what went on. Okay, perfect. You guys can hear me. You know what? I'm not touching nothing. I don't know what I might have possibly did, but we are talking about networking with one another. And if you see someone in your chat, and guys, I want you to put in, if you are an agency owner, put agency. If you want to start an agency, put once, because I want everyone to know who everybody is, because this is all about us working together. It's all about, it takes, you know, when it says about a child, it takes a tribe to raise a child. Let me tell you something. It takes multiple people. Graceful, Tina, awesome. It takes multiple people on your team to help you grow your business and make your business successful. And this is an industry that we are in, that everybody can be making 7 digits. Okay. And when I say that, I mean there are 60 million people on Social Security disability. 60 million people. So if you just had your little portion of people, how thriveful will your business be? What we're going to be talking about today is we're going to be talking about how to get private clients. You guys want to know how to get private clients? I want you to put in the chat private. Let's talk about private clients, because everybody wants that money, right? Everybody wants that money. So we want to talk about private clients. Okay, that's right. That's right. Everyone wants to talk about private clients because, see, the waiver program is fabulous. But, you know, the waiver program is not the most high-paying platform. It's the private clients. So I want you guys to get a pen and paper, because I'm going to give you several outlets that you can go to get private clients. Okay, first of all, you guys have to look at the circle that's around you. Okay, and look at who your influences are. You want to start with your immediate friends and family. That's right. Everybody that you know, you need to let them know, I'm thinking about starting a home healthcare agency, or I own a home healthcare agency. Guys, let's keep them hearts going. Let's keep them hearts going. Let's share this chat out to multiple people. Let's get this chat nice and hot. We had it. It was getting hot, but we had to get out. So, you know, let's keep it going. Let's keep it going. You want to let your immediate people know that I own a home healthcare agency. If you know anyone that needs any home healthcare, services, let me know. You want to take the time to maybe even do an invite, okay, and have people over that you know, and do a demonstration to let them know the services that you offer. This gives you time to practice. Thank you, Tina, for liking this. Thank you very much. And it gives you the opportunity to discuss different strategies that will attract private clients to your home healthcare agency. Now, I made a post today and I told people, which one of the most important things is you want to have a niche. You hear that being said a lot for content creators. But if you own a business, you want to have a niche. So as a home healthcare agency owner, who do you want to serve? Do you want to just do companion service? Do you want to service people in certain areas? Hi, Fabulous. Thank you for joining. Guys, keep tapping the hearts, and please go grab your daily heart for today. Do you want to deal with people with different diseases? Do you want to deal with people that have dementia? I will tell you that dealing with people with dementia can be very challenging because they have a lot of memory issues. They can get very aggressive, but they don't mean any harm. You know, it's the disease taking over them. Okay. Hi, Dally. Welcome, everybody. Hi, Marcy. Welcome in. Thank you, Graceful, for liking this chat. Guys, keep tapping the screen, and send this out. Number one, the first gift that they ever sent. Oh, thank you for sending my heart, Nee. Thank you, Miss, what is this? Taryn, I can't see because my glasses. TREACE. Thank you very much for sending my heart, Nee. Come on, guys, give me some more heart Nees going on. But people with dementia, don't necessarily mean to be aggressive and irritable. That is just the disease taking over. Do you want to take care of clients that's 24-hour clients? I had a lady, her name was Miss Gail. She was a 24-hour client. Okay, you are from Pittsburgh. Okay. Oh, okay, nice. From Pittsburgh. Very nice. And she was a 24-hour client. Now, if you have a 24-hour client, you got to be prepared to have your cell phone on at all times. You have to understand, being in this business, you are taking care of people's lives. You're taking care of family members who are trusting you to take care of their parents. So when they have a question or they have a concern, you have to be available to them at all times, okay? That is important. Okay, so once you figure out who you're going to be servicing, that also comes with you figuring out your brand. You are absolutely right. She says you never sleep because they're truly dependent on you and will call you. I get calls 7 something in the morning, and I'll be looking at my phone like, no, they're not calling me on a Sunday 7 something in the morning. But that's part of the business. You know, sometimes you have clients that you aren't aware of it when you first get them, but they have mental health issues. Okay. And so you have to learn how to care with them. You have to care all of your clients with gentle hands. You're right. You never sleep because they do truly depend on you, and they will call you all day long. Guys, keep inviting this. Send an invite out to as many people as you possibly can. I don't want to touch the screen, so I'm going to be dependent on you guys. You're absolutely correct. They will depend on you. And if you are not at least your first year and a half in business, prepare that you're going to be available on your phone. You might as well not get into the business. Not saying you have to work 24 hours a day, because I'm going to show you actually how you can set things up and you only have to work a couple hours a day, because you don't want to be working for your business. You want your business to work for you. You want to be able to make money while you're sleeping. That is the goal. And you hit that goal when you have those 24-hour clients. Thank you very much for sending that popular live out. That's right. When we send that popular live out, that lets TikTok know that, you know, we are sharing something of importance, and they invite people in. And one thing, thank you very again for the popular live. Again, I love it. Thank you. Because people tend to I lost my train of thought for all them popular lives. But what I was saying is, you're gonna have to be dedicated to work this business. You have to be dedicated to your clients. One thing that I recommend everyone to do, I call it getting into the trenches. When you're about to start a home healthcare agency, especially if you've never been in the field before, you need to, thank you, Ms. Thompson, for liking it live. You need to service some clients. You need to know, hello, Miss Lady, how are you? You need to know what it feels like to be an aide. Because if you've never been an aide, how can you relate to your aides? And your aides are going to be your biggest billboards. Your aides are either going to bring you a lot of business, or they're going to hurt your business. So you want to be able to understand their pain. And when I first started out, I had a client, her name was Michele Robinson. She was paralyzed from the waist down. She was only 59 years old, and she worked at Children's Hospital when she was coming home, and she got hit by a drunk driver, and they pinned her up against the wall. She was very, very, very bitter. I'm so ready to obtain more clients. I no longer to go through a place for my mom or care. Okay, that's right. That's right. And we're going to talk about how you obtain clients. I'm going to give you some places that you can start networking with. But anyway, she was paralyzed. She was very bitter. She had very young children. She was only in her 30s. The first year of business with her, I went through 16 aides. Her pet peeve was people being on time. I personally served her as a client. And one time I took an Uber. The Uber dropped me off at the wrong place, even though I showed them on the screen where I was supposed to go. And I was about 8 minutes late. She literally went off on me. And I'm going to be honest, I walked out on her, because you're not going to talk to me any type of way. But what I had to do is I had to train her on how to treat the clients. How, if there's an issue, who do you contact? So you don't necessarily just have to train the aides. You have to train your clients too. Okay, you gotta take the time when it's time for you to go do that assessment. You gotta make sure in your assessment you're asking them, what's your pet peeve? What time do you like to get up? Are you a TV person, or do you like the radio playing? How do you, even as far as cleanliness, cleaning their products? I had an aide for Miss Douglas. The rag that she used to wash the dishes, she used to wipe the table off and the chairs off. And Miss Douglas got really offended and said she actually did need a nurse, but you know what? She wasn't eligible. Hi Diamond, how are you? Thank you for coming on. Do you need a nurse? This is what I will say. If the state paid more money, I think every home health care agency should have a nurse to work for them, to where a nurse can go out and do an assessment on each and every one of the clients. Now, if you are a nurse, you want to go with the agencies that are skilled. Okay? Skilled nursing for the nurses. But unfortunately, as non-medical, our hands are tied, and they only pay a certain amount of money per state. Like, I'm in Pennsylvania, and I think we're one of the lowest states. For the waiver company, we only get paid $21.35 an hour, which is horrible. So that means we can only pay our aides $15 an hour, tops. tops $16 an hour, right? You want to make sure you pay the Act 159 is 1932. I wish that was in Pennsylvania. That would be a blessing. I don't know if that's state related or what, but I don't think that it is. You said it is? Wow. I got to look that up. Because I don't know how they want us to pay 1930 in Pittsburgh. 1930. Oh, so wait a minute. How much does the waiver company pay you in Pittsburgh? I'm really curious to find that out. Wait a minute. No. I'm saying in Pittsburgh for the waiver, the MCOs is 20. Wait a minute. So it's 20 and they want you to pay your aides 1932? Maybe I'm not understanding what you're saying. But let's go on. You want to make sure that you pay your aides fair, but you also don't want to pay your aides too much coming out the door. Oh, okay. No, the Act 155 only pays 1932. I got you. You don't want to pay them. Let's say you're paying your aide $16 an hour. The insurance MCO pays 20. Correct. You're paying, in your head that you want to pay your aide $16 an hour. This is what I tell people. Yeah, between $13 and $16 an hour. Exactly. And that's what I was just about to say. You don't want to pay your aides top dollars when you first hire them. You want to pay them at a lower rate, at least $1 more. And you tell them after 90 days, you get a 50-cent raise. After another 90 days, you get another 50-cent raise. Because you want to make sure, number one, they're going to be on time. They're not going to be calling out. Okay, guys, make sure you share this link out. And let's keep them hearts going and go. Grab your heart knees, guys. And make sure you guys follow me so you can get my videos that I have coming out every day. And you can also get notification when I'm going to be going live. But I've learned when you start high, they BS going to work. Well, me, I find out. I've experienced that when I pay them top dollar, 85% of them are horrible. Because they're one way on the interview and they are something completely different after they don't work with the clients for 30 days. You guys got to get past 30 to 45 days to know if you have a good aide or not. Okay? Because the first 30 days, they have what I call their representatives showing who they are. You're not going to know truly who they are. Okay? That's number one. But let's jump into private clients and how you get private clients. First of all, you want to identify your circle of influencers. Okay, you're welcome, Graceful, of influencers. What I mean as influencers, your family, your friends, people that you know are in the medical field. What you need to do when you get off this live is you need to make a list of everyone that you know, your parents' friends. Okay, I'm 56 years old. Unfortunately, my mom passed away January 17th. But all of her friends were in, their late 70s, early 80s. And you want to let them know, hey, I have a home healthcare agency. I'm providing services for people. You want to go over, you want to maybe invite people out to lunch. You can have something even in your home, a grand opening, telling people about your services, your neighbors, letting your neighbors know that you are a home healthcare agency and you service clients. Then you want to start going out to the community. The community is going to be your best friend. Okay. Some of the places where I've got my best results from are from places that are, what about the paperwork? What are you asking me about the paperwork? Are you talking about your license? Are you talking about your policies and procedures? Because there is a lot that you're going to have to go through to get licensed. The first thing you're going to have to go through is go through your state, and you're going to have to fill out an application to apply for a home health care as a home health care agency. Then you're going to have to get your insurances. Then you're going to have to get your policies and procedures in place. I'm not going to lie to you. In the very beginning, there is a lot of preliminary work you have to get done. I have several people on my team that specializes in policies and procedures, and it all depends on what state you are. Different states require different things. Diamond, where are you located? So it really all depends on your state and what your state expects from you. You're from Florida. Okay, we got a couple people in here from Florida. Diamond, are you an agency or are you trying to become an agency? Which one are you? Florida is a big state because you guys, that's where all the baby boomers are. And you were saying some of the best places you're getting clients from. Oh, I'm going to get back to that. I didn't forget about you, sweetie. Brittany. We got Kathy in Michigan trying to become an agency. Okay, so you want to link up with people that are in the state of Florida. The state of Florida, I think, is any warm state. You guys have the advantage than us, because a lot of the seniors and disabled. Okay, Tina, you're from Mississippi. Guys, thank you for sharing the hearts. Thank you for sharing the hearts. Go up, grab your deli hearts, and make sure you follow me. Okay, so we got Miss Love Remini. Love Home Care LLC is asking, is there anyone from North Carolina? Do we have anyone from? Okay, we got one person from North Carolina. Very good, very good. Any warm state, you're going to have a lot of seniors and a lot of disabled in your state. So if you're looking for private clients, the first place you need to visit are places 62 years and older. California, Brittany is in California. 62 years and older. You want to call and ask Orlando in the house and ask for the events coordinator, okay? And ask them if you can come in and do an event with their with the tenants, okay? I will tell you, 9 out of 10 of them like to do bingo. We've done bingo. We'll have done word trivia. And what they're going to do, 9 out of 10, is going to ask you for a flyer. You're going to create a flyer, letting them know Healing Hands Agency is coming to you. Bingo day. Come join us at such and such. We have refreshments going on. We'll be playing games. We're going to have a ball. When everyone comes in the room, before you start playing games, the first thing you want to do is introduce yourself. Hi, my name is Robin Michele. I'm from We Care Home Care, and I am a home health care agency in your area. We are actually about 10 minutes from you. We are available 24 hours, 7 days a week. And I just want to let you know the services that we offer. And you go in and tell them about the services that you offer. But what you want to do is you want to allow the people to ask questions. What happens if my aide calls out? Am I going to be left by myself, or are you going to have someone to fill in? Do you have someone that's going to provide me transportation? Because I need to get to my doctor's visits, and I don't like the transit system. Okay, you want to answer their questions. Okay, when I went to several places, they told me that's one thing they appreciated is that I did the question and answer. So you got the 62 years and older. You got the dialysis centers. Okay, You want to make sure you target them. You got the hospitals. You want to talk to the discharge coordinators or the social workers. And because you want to let them know, I am from your local community and we help people. We're able to provide services within 24 to 48 hours. We help clients get set up with the waiver company. And if you guys don't know what the waiver company is, you need to look it up. It's a federally funded program that's available. It's based on your income. In Pennsylvania, you can't make over $2,904 a month. Welcome. Thank you guys for coming in, and you guys invite this out. And guys, for 1 penny, if you could go grab that popular live from out the little box with the heart with the bow on it, I would appreciate it. That lets people know that this chat is valuable. But what was I saying? I lost my train of thought. But anyway, the 62 years older, the dialysis place, the social workers at the hospital, you want to reach out to them, let them know that you can service somebody within 24 to 48 hours. Technically, it's 72 hours, but if they're a private pay, you can service them immediately. If you have someone call you and tell them you want services, you want to touch bases with them within 12 to 24 hours. If you take any longer, when you call them, they're going to tell you that they spoke to another agency. Okay. When you reach out to the hospitals, you want to let the hospitals know that you have a database of caregivers and you have caregivers on call if anyone should come out, and none of your clients are ever left without services. Okay, you want to let them know I specialize in dementia, I specialize in bedbound clients, I specialize in 24-hour clients. Now, if you're looking for the money, I'm going to tell you that's where the money is. Your dementia, your bedbound, and your 24 hours. Okay, now if you just want to do companion, someone that got a broken hip, you want to reach out to the rehabs because all of the rehabs, the nursing homes, the hospitals, they all have social workers. They know everybody that's in their facility. When people go into the rehabs, they're only in there for 30 days. That's all the insurance will pay for. Okay? So the social workers knows who's about to be released and who's, hi, Miss Jones, welcome to the chat, and who's not about to be released. And you need to say to them, do you have anyone that's about to be released and they need home services? My name is Michele, and I am a home health care agency in your community. And we are available 24 hours a day, 7 days a week. That is my line, 24 hours a day, 7 days a week. Even though you provide 24-hour services, you got to say, hello, how are you? Emilian, you have to constantly say that. So you got hospitals, you got rehabs, you got nursing homes. Nursing homes, you can go in and you can say to them, hey, do you have anyone that's going to be coming out within the next 30 days that needs waiver services? Okay, because people say if they fall and break their hip, okay, and they're going to need waiver services. It takes between 30 to 45 days to get them approved for the waiver services, and that's people that's on Medicaid. Guys, welcome. Thank you for coming to the group. That is on Medicaid. If you want clients as soon as possible, where should you go? Okay. That's a good question. So are you talking about private clients, or are you talking about waiver clients? You talking about VA clients? What type of clients are you talking about? I will tell you the fastest way to get clients is through the waiver company. I have a cage code. I want VA clients. Okay, so if you want VA clients, you have to go through the third-party companies. That's very good that you have the waiver company. There are 3 companies that you can go through the waiver, through VA to get VA clients. Hold on, let me pull that up on my computer real fast. And you want to call them and let them know that you are part of the VA community and you would like to join their network, and you are able to provide services 24 hours, 7 days a week. Guys, you need to continue to repeat that to yourself over and over again, 24 hours, 7 days a week, because that is a big selling point. Hold on one second. So we need the VA. What state are you in? The person that just asked me about okay, you're in Georgia. Okay, Georgia's in the house. Hold on. Okay, give me 1 second. You want to get in contact with VA discharge planners. You want to go down to your local VA community and ask to speak to, oh, thank you. And ask to speak to one of the social workers. Guys, you want to make sure you always have your flyers or your brochures with you. I don't have it on me right now. You want to make sure you always have your flyers or your brochures with you. I don't have it on me right now, but sorry about that. That's my daughter calling me. I do postcards. Look at this. Let's just say this is a business card and this is a postcard. Okay, which one are you going to save more? Are you going to save the business card, or are you going to save the flyer? Okay, I always love flyers because people tend to hold on to them. You want to leave a stack of flyers and at the different VA hospitals. Hold on 1 second. I'm trying to find this app. Okay, so you want to go through referrals. You want to go through TriWest. That's TRWEST. I'm going to repeat it again. TRIWEST. They are a third-party company that works with the veterans. You also want to call Optum. 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 They work with, thank you for sharing the live. Thank you very much. And guys, keep tapping the screen. Let's get them hearts going. Let's get them hearts going. I love to see the hearts going. That keeps me talking. And grab, you just are coming in, please go up and grab your daily heart. And please make sure that you follow me so you can continue to get your information. Thank you very much for liking the live. I appreciate it, 121. I appreciate it. Thank you, user. Thank you, KC. Thank you, thank you, thank you, thank you. Thank you for liking the live. Okay, so let me go over it again. Who do you want to contact if you want to try to get VA clients? Optum. OPTUM. Another major company is TriWest. TRIWEST. Okay, they basically have the buckets of all the clients. Now, wait a minute, TriWest is no longer credentialing in Georgia. Are you serious? All right, well, try Optum. Okay, and try to reach out. Thank you, KC, for liking the live. And try to reach out. Can some write the first one? Can't some write the first one? I don't understand Business Savvy. I know Opta is closed in Ohio. They have been closed for a few years, but I'm on the waiting list. Wow. Ohio is going through a lot, I'm noticing, with the home health care agencies. Business Savvy, I don't understand what you're saying. Rewrite your question. Thank you, Casey. And guys, thank you for sending the loves out, and thank you for sharing it. If you guys can go in that pink box with the white bow and grab that popular live for a penny, I would truly appreciate it. That supports me as your host. I'm on the waiting list in Georgia for well, I'm going to let you guys know that you are going to be on the waiting list. Now, if you want to get off the waiting list and get into the pool of people, you need to start calling Optima. You need to start calling TriWest. Hi, my name is Robin Michele. I'm calling from We Care Home Care. I am a home health care agency in the 19144 zip code. Can you tell me who manages that area? Find the person's name. Get their email address. Okay? It's the same with Tennessee. Can someone write the first VA company mentioned? Oh, guys. Okay, so let me say it again. Business savvy. Go grab a pen and let me know when you got a pen, and I will spell out the names again. Get their email. Okay? Go to MailChimp. Okay? Because you want to start an email campaign. Georgia has a new agency credential on hold for 2. That's sad. I have a pen now. Okay. All right. Hold on, guys. Let me give her this information. Okay. Optima. O as in Oscar. P as in Paul. T as in Tom. U as in umbrella. M as in Mary. Okay. You want to Google them. The next one is TriWest. T as in Tom. R as in Robert, I as in Ice, W as in West, E as in Edward, S as in Sam, T as in Tom. You want to get their phone numbers. You want to give them your zip code area. You got it. There you go. Thank you, Amelia. Driving can't write. Grateful, Florida. Let me write you down. I'll see if I can if you're following me, Grateful Care, Florida. If you're following me, I will send you a message. You want to reach out to them and you want to find out who the coordinator is for your area. Guys, I'm sorry you hear my grandbaby crying. He's not feeling well right now. You want to find out who is the coordinator for your area. You want to get their email address, okay? And you want to do an email campaign. You want to send them an email twice a week. Now, you may think that's excessive, but can you imagine how many emails they're getting every day? And you want to do them both. Hello, Robin Michele. This is such and such from this agency. You want to list down all your services and what you're doing. We are open to take VA clients. We are open to take Medicaid clients. We are open for early discharge clients. Optima keeps telling me that that is not a need for new providers in my area. KC, what area are you in? Did you try TriWest? Did you try your local VA? Have you went down to your local VA? Tennessee, have you went down to your local VA office? Guys, let me tell you something. Sometimes you got to do that. You got to spend a couple dollars. When you go down a couple times, yes, I went down there. And what happened when you went down there? What did they say? What you got to do is you got to make yourself known. I'm going to make myself known. Okay, if that means that one day I have gone to the VA plenty of times. Well, you got to go down there with a box of donuts from Krispy Kreme or Dunkin' Donuts and a jug of coffee. You're going to have to go down there with something they're going to remember. Or go down there with a box of chocolates or go down there with a big thing of fruit. You got to do something to get them to remember who you are. Because when I walk in a room, I want you to remember my name, Robin Michele, with one L. The state is no longer accepting new agencies. Well, then what you want to do is you want to, if that's the case and you're with the state and they're not accepting new agencies, you might want to partner with an agency. And you might, okay, guys, also write this down. Next door. Next door. Next door. DOOR. It is an app. It is a free app. Guys, keep tapping the screen. Let me see them hearts going. Let me see them hearts going. I want to see some confetti coming down. Let's get that confetti going down. Let's see some popular lives for 1 penny, guys. 1 penny. Let me see some popular lives. What was I saying? Oh, you want to partner with some agencies. You want to go to Nextdoor. And yes, you would love to partner with someone. I'm going to tell you how to do it. Thank you for the lives. You want to go to Nextdoor and you want to put an ad looking We Care Home Care, looking to partner with other agencies available to take VA clients on call. Okay, Graceful, you're using, okay, Graceful Care Florida is using Nextdoor. Nextdoor is phenomenal, okay, for getting leads, okay? So you want to go Nextdoor and you want to promote yourself. You could say that I am available on E-Million I'm going to get with you. I am available for on-call for VA clients. But if you do that, okay, CEO, Shay, a CEO, you're using it as well. But you have to be prepared. If they call you and they sit and say to you, I have a client that I need someone to take care of tonight at 7 p.m. and it's 3 p.m. You may have to go take care of that client to get in with that agency if you don't have clients on standby. I tell people all the time, constantly advertise on Nextdoor. I don't care if you don't need aides. Interview people, have them do the training so you can have yourself a database of aides that's available. Okay? For both private clients and oh yeah, let me tell you something. You're about to get me excited. Let me tell you something. My first, I'm not even gonna lie, I'm still not doing paid advertisements. Everything I do is free and a word of mouth. My phone is ringing all the time with clients. You want to go to Facebook, whatever area you're in. If you're in Ohio, Florida, you want to Google Ohio, Florida home health care, Ohio, Florida senior care, and look at all those groups that come up for senior care. Ohio, Florida, 62 years and under. Ohio, Florida, social workers. Get into those social worker groups. Hi, my name is Robin Michele from We Care Home Care. Trying to reach out to social workers in the Orlando, Florida area. That's right. She said I posted on my Ring camera. That's right. But let me tell you what you don't do. You don't just post it once. You don't post it twice. You post it every single week. And if you got to, you post it every day. Because you will be surprised. Your phone will start ringing, but you gotta put the time in. You gotta put the effort in. If you're not willing to get into the trenches, your business is not going to thrive the way you want to thrive. You see some clients, some agencies, they have several hundred clients, and then you see other agencies that only have 30, 40. Why? Because you got to be willing to get down and you got to grind. You got to start yourself a street team. It's Nextdoor for aides, or can you get jobs from there? You could do both. You could do both. I get a lot of my aides from there and I get a lot of clients from there. Let's say you're a nurse and you want to do some private duty work. Advertise it on Nextdoor. No, I'm not in Florida. Actually, the agency is in Philadelphia, Pennsylvania. Right now, I'm in Maryland. And guess what? I signed on the past month. I signed on 7 clients right here, being where I'm at, doing it remotely. What was I saying? Let me go back and look at the questions. Is next okay? So next door, if you're a nurse, you can post private duty jobs on Nextdoor. If you're looking for aides, you could post aides. If you're looking for clients, you could post clients. Guys, I want everyone to type in, what am I saying? What am I saying is supposed to be your slogan? Who knows what your slogan is supposed to be? You offer what? Let me see if anyone knows what I'm talking about. I'm going to say it again. And I'm going to say it, and I want everyone to type it. I offer 24 hours, 7 days a week. That's right. That has to be your slogan. I offer 24 hours, 7 days a week service. You keep saying that, you keep pushing that, and you're going to see more clients coming to you. Okay? So you want to go, let's just do a refresh of places that you want to go to. You want to go to the hospitals. Now, if you're calling the hospitals and you're getting the social workers voicemail, after calling for 2 weeks, call the administrator of the hospital. Hi, my name is Robin Michele. I'm a home health care agency in your area, and I've been calling your social worker department and leaving messages, and I have not been able to get through to anyone. We have caregivers. We have a waiting list of caregivers, and we're able to take someone and get someone started within 24 to 48 hours. Let me tell you something. That administrator of the hospital, you know what they're going to say to you? What I'm going to do is I'm going to get in contact with the supervisor of that department, and I'm going to give you their name and their phone number. You got to push. You can't be satisfied. Okay, I'm located in, the agency is located in Philadelphia, Pennsylvania. Guys, thank you for the hearts. Let's keep these hearts going. We're almost up to 6,000. Let's get to 10,000. Let's get to 10,000, guys. Let's keep it pushing. But yes, so that's what you do with the hospitals. Now, what you do is the facilities that service people in their home and send nurses out to them. Okay, I cannot think off the top of my head what they're called. But when someone leaves the rehab, they have a nurse or a physical therapist come out and visit them. Hold on, what? Hold on, guys. I want to give you this information, but I can't think off the top of my head. What's it called? When someone leaves, okay, you got, this is giving me in Florida. House care managers discharge. No, that's not what I'm looking for. Okay, another good place to contact. A lot of hospitals have their own home care agency. That's true, but you know what you do? You go to the smaller the hospitals. If you're in a big community like Orlando, and you are licensed for the county, go outside of Orlando, okay? And you don't got to worry about getting an aid. All you got to do is post on Nextdoor. I'm going to give you an example. I had a gentleman, Mr. Randall. He was in Chester. Chester is 45 minutes from Philadelphia because we're in 5 counties. And I was just talking to him for the first time, and he told me he was tired of his age. He was getting on his nerves. As soon as I hung up the phone, I contacted my assistant, and I told my assistant to put an ad on Nextdoor. The same day I was getting ads in. So go outside of your local area and start talking to those hospitals. Okay, but a good place that you want to reach out is to wound care facilities. People that go out and service people that have wounds. Anyone that has a wound, you know that they need the services of a home health care agency. Okay, traveling nurses. Okay, you might want to post on Nextdoor. You might want to post on Craigslist. looking to connect with traveling nurses. Okay, because you guys can help one another. How? You're a home healthcare agency. You're going to have clients that need a nurse. She's a nurse. She's going to know a lot of people that needs a home healthcare agency. You say to her, hey, my name is Robin Michele. I'm from We Care Home Care. And I understand you're a traveling nurse. How long have you been doing it? They'll sit and say how long they've been doing it. Well, I want to talk to you because we have an affiliate program. Are you interested in making another stream of income? Did you hear what I just said? Are you interested in making another stream of income? We are looking to work with traveling nurses that can refer people to our agency, and we are paying a recruitment fee of $300, whatever you decide. Some people, I pay them a flat fee of $300. Some people, I pay them 30% of whatever I make after expenses. Say if the client brings in $1,000 profit, I'll pay them $300 a month because they're bringing me multiple clients. Okay, so you have to do that. You want to get in contact with transitional care providers. Okay, transitional care providers are good people to communicate with if you want VA clients. Okay. Also, guys, let's keep tapping the hearts. Tapping the hearts. We want to get up to 10,000. We want to get up to 10,000. Let's keep tapping the hearts. Another place that you can reach out to get VA clients are shelters. There's a lot of veterans that are homeless. Reach out to your shelter communities. Take your flyers. You will be surprised how many clients you get from there. If you are a home health care agency, what you want to do is you want to build relationships with people that have independent housing. You want to build relationships with people that have group homes, okay? Because they are housing the people that need the home health care services. Okay, KC, thank you for liking the live. Guys, come on, let's get some hearts. I want to see some confettis going on. If you haven't grabbed that deli heart, go grab that deli heart and become a fan member. You want to reach out to these people. Physical therapy offices. Okay, there's a lot of private physical therapy locations. You want to go in there and you want to give them your brochures. You want to give them your postcards. Business cards are fine. I'm not a fan of business cards because people lose them each and every day. Occupational therapists. You want to reach out to them. I'll tell you another big one. Speech therapists. If you want to be someone and you just want to do companion, my office has a physical therapy location. Very nice, business savvy. Awesome. Yeah, if you can partner with a private physical therapy office and you can offer them some type of affiliate program, when people see this, they tend to start talking. And let me tell you something. Since 2015, I've been working with affiliates. Make sure the first thing you do is pay your affiliate. Your affiliate are your horses. They're going to keep people coming in. Pay your affiliates. Okay? So speech therapy. Speech therapy is going to give you a range of clients. Okay? You can have clients from the age, especially for the waiver program for any service from the age of 21 up, that can be a client of yours. Okay, guys, we're almost up there. We're up to 74. Let's get up to that 10,000. The 10,000 hearts. Keep tapping that screen. I wish I could tap my screen. I would be tapping. Anyway, Speech therapy, you're going to get a range of people. Thank you, Shay Shay, CEO, for liking the live. And you guys share this live out with people. I'm scared to touch my screen because of what happened the last time. We would be up to 10,000 right now, but we lost those hearts. Another thing. Now, I want you guys to listen to me because you may say, Robin, Michelle, you crazy. You want some private clients? I'm going to tell you a lane that you never thought about. Post-prenatal care. Post-maternity care. After the mothers deliver their babies. That's private money. That's rich man's land. Did you hear me? Mothers that are having problems breastfeeding. You want to get in contact with your doers. They know the mothers that are pregnant. You want to make them your affiliate. Okay? Let them know. And if it's a doer or if it's a traveling nurse, I would give them a monthly residual. You will get a percentage on every hour that I bill. I will give you 20%. I will give you 15%. Whatever it is that you come up with. That's what I would give you. You could start at 50, 20%. But post maternity, you going into a whole different lane. Now, the client may be only, 6 months? But think about it if you're charging $40 an hour. Think about it. They may need you to come. The mother just had a cesarean. She can't get up out the bed. She needs help. Okay? So you guys want to think, but no one will but have a content page. No one will but have a content page. I don't understand what you're saying, Mama Love. Rephrase that for me. That is a good private pay client. Now, veterans, let me tell you this secret yesterday. I shared it with the people that was on live yesterday. Guys, keep tapping that screen. We're almost at that 10,000. Keep going, keep going. For veterans, if you get veterans and their family members are taking care of them, they are tax exempt from their paychecks. That means no taxes is coming out of their check. They also will provide them with medical insurance if they don't have medical insurance. So if you have a client that's a veteran, you want to say to them, hey, have you ever thought about a family member that may be willing to take care of you? Because there's extra benefits that's available. Okay? So that's something else you want to keep in mind. Another thing, if you're going to advertise on Nextdoor especially. I might have to open the door for the dog. Hold on, guys, because he's going to keep parking. I may have to go get him. Hold on. Come on. I'm sorry. He would have kept barking. Okay. What was I saying now, Lord? See, Franklin, you made me lose my train. Thank you for the heart. Thank you for the heart, me. I appreciate it. And guys, if y'all can go in that little pink box, they got the heart for 1 penny and get that popular live, that will do so much for me when it comes to TikTok. That will let them know that you guys truly appreciate the information that I am sharing with you. Thank you very much, May Jane, for Auntie Meg, for the rose. Thank you for the rose. What else do I want to share with you? Does anybody have any questions? This is the time you guys can ask me questions. I'm here to support you. Thank you. Let's get them hearts going. I'm absolutely love it. Any questions that you guys have? Another place you guys can go to. I hope you guys got a pen and paper and are writing it. Wait a minute. I got to move this puzzle or it's going to try to cut me off. Unable to verify. Hold on. Okay. Now, estate willing lawyers. Lawyers that handle people estates. You want to reach out to them. Oh, okay. You said busy savvy. I want to market all June. I need a client as soon as possible. Well, guess what? If you need a client as soon as possible, this is what I need you to do. I need you to download the Nextdoor app tonight. I need you to make your posts. Okay? When you wake up in the morning, I need you to make another post. Okay? I need you to go to what is it called? Chat GPT. And you need to tell them the name of your agency. Make me a image, the name of We Care Home Care. Let it make you up a flyer. Post that flyer. Post what your services are. But back to what I was saying. Estate willing lawyers. They deal with a lot of elderly people. Go to Google and type in estate willing lawyers and put your zip code in or the surrounding area. Okay. Do you think private clients or as a new client okay, that's a good, let me just finish this. Put that zip code. I'm going to get back to you, Graceful Care. Put that zip code in. If you got a downtown area or you got a suburban area that's a richer area. Estate willing lawyers, elderly care lawyers. Look them up. Okay? And you want to reach out to them. Do not reach out to them once. Do not reach out to them twice. You get you a spreadsheet and you start writing the company's name, the person you talk to, their phone number, and their email address. And once a week, you sit down and you go over that list. You go to MailChimp, just like a chipmunk, MailChimp, and open you up a free account. Okay? You can do an email campaign up to 250 people for free. Okay? Hi, Diamond. How are you? Okay, you want to open up an account. Those lawyers... Okay, estate willing lawyers you want to look up, elderly care lawyers you want to look up, hospital social workers you want to look up, rehabs you want to look up, dialysis you want to look up, get names, get phone numbers, and start sending them out emails on the constant basis. Make you up nice, bright, beautiful flyers. Put down what your services are. Okay, you want to go into drugstores. How many people got a CVS? Drop CVS. How many people got a Walgreens? Drop Walgreens. Okay, how many? Well, it's no more Rite Aids. Go in there, go to the pharmacist. Hi, my name is Robin Michele. I own a home healthcare agency right up the street. I'm wondering if it's possible if I can leave some flyers in here. Leave them in there. Or guess what? One day, just stand outside of the drugstore. Like the first of the month or the end of the month, go to the drugstore and just hand out your information. Okay? Another place that you can go to. The Social Security office. The Social Security office. Okay? Go down there. Talk to people. Now, you said, let me go back to Careful Care from Florida. You said, as a new agency, do you think private clients or insurance? I'm going to tell you both. And I'm going to tell you why. Because if you get all clients that are insurance, you're going to have to wait 30 to 45 days, sometimes 60 days before you receive a payment. Those private pay clients is what's going to keep you afloat. Okay, so you want a combination of both. Guys, keep tapping that screen. Keep tapping that screen. If we can grab that popular love for 1 penny, you don't understand how much that penny will mean to support my group. That's what you want to do, okay? So you want to have a combination of private clients and insurance clients. What did I say? You want to go to 62 years and older. You want to ask for the coordinator of activities. Ask her, can you schedule an appointment? They're probably going to want you to schedule it for next month. So who was it that said they want to start advertising for June? Business Savvy. This is what I want you to do. And I want you to DM me after you do it. Tonight when you get off the phone, I don't know what time it is, I want you to look up in your area communities for 62 years and older. I want you to call them tomorrow and tell them the name of your business and what your name is, and you would like to schedule an appointment to come in and do an activity with their tenants. I'll bet you anything you will have some appointments. Trust me, guys. I've done it. I have Medicaid and I don't know where to go to get them. Okay, you don't know where to go? I'm going to tell you where to go to them. The county assistant's office. Okay? So if you are, say you are in Orlando, Florida. Okay? Yes, you Business Savvy, I'm talking to you. I want you to Google 62 years and older communities, and I want you to call 5 of them tomorrow, and then I want you to DM me. Casey, thank you for liking. Guys, we hit 10,000. Yay! But we're going to keep going. Okay, for Medicaid. Business Savvy, tell me where you're at again. Are you in Tennessee? That's right. You do that and you send me a message. You're in Virginia. Okay, so say you're in Richmond, Virginia. You want to Google waiver office for county, main waiver office for the county assistants. Google that. Or call your local, okay, Megan, Auntie Meg, you're in PA. Okay, I want you to call your local county assistance office in your community, and I want you to ask them, where is the main office located that receives your waiver applications? Every county may have about 15 county assistance office or welfare office that people come bring their waiver applications to. They're all forwarded to one local office. You want to find out what that one local office is, and you want to go down there with your brochures and spend about 2-3 hours, 2 days a week. In Philadelphia, I'm going to tell you, I go to 52nd and Parkside. I walk away with 5 to 8 clients every time I go down there. You don't need to spend a lot of time. I just made my contact list for the hospital and rehab. That's right, Graceful. See, that's what I'm talking about. You got to put that effort in to want to do it. Every time I go down there. I had one girl, Miss Gibson. She called her coordinator on the spot and said, I want to transfer to Rob and Michele. Guys, we got 18 people in there. We only got 7 heart knees. Guys, go up and grab your heart knees because we're about to end this soon. Grab your heart knees and continue to tap it. Continue to tap the screen. I truly appreciate it. Guys, I was exhausted. Now I'm full of energy. My daughter-in-law told me this was going to happen. She was like, watch when you get on, you get all energized. And I am all energized now. So someone just said, where do I get clients? Okay, Dreamful 30, where are you located and what type of clients are you trying to go after? Are you trying to go after, I opened a new business and with some money, and how do I get clients as soon as possible? Okay, you guys got a community for seniors are talking about apartments. Correct. Community centers for seniors, correct. Long-term facilities. Correct. Long-term facilities can be a hit and miss. Correct. Okay, let me go over it one more time. Places you need to go to. Guys, get a pen and paper. Everyone let me know when they got a pen. Type in pen. Type in pen, and I'm going to start to give you a list of different places you guys can go to get clients from. I am so proud of you guys. Everyone is doing fabulous. Okay, so I see 2 people that got pens. Come on, come on, come on, come on. Let me see it, let me see it, let me see it, because I'm about to start and I'm about to end for the night. So I want you guys to get all this information. Okay, so still graceful care. Graceful care, I'm going to send you a message. Casey, thank you very much for liking the live. Keep liking the live, guys. I so appreciate you guys. Okay, so 62 years and older, senior living. Luxury, and put this word in there, luxury senior assistant facilities. You guys want to sit and think, what areas have the money? You want to go in, you want to find out that zip code, and you want to type senior assistant living. 62 years and old, that's where your private pay money is going to come from, okay? You want to go to your dialysis centers. There's dialysis centers all over the place. They got to go to dialysis. They're open 7 days a week, okay? You want to contact your elderly care lawyers. Yes. Okay, that's a good question, Shay Shay, CEO. When you go into the senior, guys, now he wants to go out. Give me a second. Go ahead. Do you want to go out? Go ahead. Go ahead. Go ahead. Go ahead. Go. Go ahead. Go ahead. Go ahead. Go ahead. Okay. So now when you're contacting the senior facilities, you got to be prepared to do an activity with them. Okay, so go to Amazon and order you a bingo game. Okay, it's a ball with bingo. If you guys come on tomorrow, I'll share you my link I got. I think I paid $24 with it. You can do bingo. You can do movie trivia, 70s trivia with them. But before you go in, then you go to the dollar store. If you want to really make them remember you, before you go in, then you go to the dollar store. If you want to really make them remember you, $8, okay? And buy you some gift bags, some hand sanitizers, some tissues, some peppermints, and make them up little gift bags, okay? And when people win, you can give away the gift bags. So you got to be prepared to do that for the senior living. Okay. You want to, your hospitals. If you can't get through to the social workers, you want to call the administrator of the hospitals. Wound care. I hope I'm not going too fast. Wound care facilities. Traveling nurses. That's right. Keep them hearts going. Keep them hearts going. Traveling nurses. Drugstores. Drugstores. You want to post on Nextdoor. You want to download the Nextdoor app. Twice a day, if you can. You want to go to Facebook. You want to start out. Thank you, Casey, for sharing the live. Thank you, Ani, Megan, for liking the live. Thank you, Casey. Thank you, guys. I appreciate it. Thank you for your hearts. I appreciate it. Go grab them popular lives, because we're about to be out of here. You want to get in contact with Optima for VA clients. You want to get in contact with Tri-West. Optima, OPTUM. They are the third-party facilities. Tri-West, TRIWEST. Okay? You want to reach out to them. Let them know that you would like to join their network. You're a home health care agency and you work with veterans. Your shelters. You want to get in contact with social workers at your shelters. Food banks. You want to get in contact and see people that are doing VA housing, people that are doing independent housing. Thank you for the fan club, Betty Soon. Thank you. You want to get in contact with them. Thank you for the heart. Thank you, God. Thank you. Oh, you're making my night. Thank you, guys. Thank you so much. What else? Who else can I tell you guys? You want to, cardiologists. Look up your cardiologists. Go to Vistaprint. Okay, go to Vistaprint. And you want to design you a postcard. Okay? I'm going to show you something. I'm still helping you save some money. Some people will go make a flyer. A flyer is this size, right? If you take this piece of paper and you fold it in half, this is the size of a postcard. One piece of 8 by 10, you have 4 postcards. Okay? Make your money work for you. Okay? You could go to CVS. You could go to Walgreens. Don't go to Staples. Staples is too expensive. And get your marketing material. If you guys don't know how to work Canva and don't know how to create, go to Upworks or what's the name of it? Upworks or oh my goodness, I can't think of the name of it. Upworks or I can't think of the name of it. All I can think of right now is Upworks is on my phone. And get you a virtual assistant. Fiverr, thank you. I couldn't think of the name of it. Fiverr. And get you someone to create you some flyers. And if you can't find somebody, don't you all reach out to me all at once. Reach out to me and I will have my assistant design a flyer for you and send it over. And you guys start marketing. Market. Get on the phone. Where can I get a virtual? I just told you Fiverr, Fiverr, or Upworks, UPSWORK. Those are the ones that's Chat GPT. I love it. Yeah, but guess what? Chat can lead you down a rabbit hole. If you need help finding a personal assistant, I've been working with personal assistants overseas in the Philippines since 2015. And I'm going to tell you, I don't pay no more than $5 an hour for my assistant. And my assistant is fabulous. Why would we look for clients at a drug? Why would you look for clients at a drugstore? Because that's where you get your private clients from. That's why you want to go ask them if you could just leave some flyers. You know, at the drugstore where they have areas where they put flyers and stuff, just go to them and say, my name is Robin Michele from We Care Home Care. We're a home health care agency right in your area. And I would, like to leave some flyers. That's why you want to go to the drugstore. I have a virtual assistant in the Philippines and she has an entire group ready to work. I told you, $5 an hour. That's what I'm talking about. Listen, it's so deep. I've been thinking about starting what's it called? A temp service for virtual assistants. Because once you get one good virtual assistant from the Philippines, they will always refer people for you. Yes, aren't they the best? It's sad, but I will never hire a U.S. They are so respectful. I don't care what time it is. And I'm a workaholic, guys. When I text my assistant, RJ, he right there on the spot. Johnny on the spot. And guess what? He started out at $3.50 an hour. You guys need someone to do your social media? My girl is $4 an hour. She posts in like 40 groups a day. We need to have a live one day just on where you get social media. Absolutely. If anyone needs one, please let me know. I would love to introduce you to them. Absolutely. I've been with them for absolutely. They're the best. And Pakistan. Pakistan is another place to get a good virtual assistant from. They're when I tell you, and it's sad because my assistant, there's sometimes when we're on WhatsApp and we got to do a share screen. You understand what I'm saying? I'll see him and it's stuff that you see in the movies, guys. I think his camera is running on a wire. You hear the chickens in the background and it's like he got metal as a roof. And they are so appreciative. And how you pay them, How you pay them, it's an app called Wise, Size. Pay them right there. And guess what? It's all a tax deduction, so don't even worry about it. All there. So guys, this was awesome. Thank you so much. We've been on here for an hour and a half. Miss, what is it? Terrence, Miss _ TREACE. Make sure you send me a message. Oh, thank you. Oh, I love you guys too. You guys, really, I was so exhausted. That's right. I gave you a business assignment and I expect to get a message from you, business savvy, and let me know what went on. I don't care if you got to call me and we got to do a 3-way and I got to make the first couple phone calls for you. I will do that for you. Guys, I'm here for you. Whatever you need. How do you get a cage code? You go to sam.gov. sam.gov. Yes, business savvy, I actually will. And Graceful Care, Florida, you send me a DM too. I'll be looking for you guys DM. I have a cage code. Yes, E-Million. Whatever you guys need, I'm here to assist you. Because let me explain something to you. I've had a lot of mentors. I've been in business since I was 22 years old. I'm 56 years old. I've had a lot of mentors and I've had a lot of coach. And I wouldn't be where I'm at if it wasn't for the people that supported me. So it's my job as someone that has the information and have the knowledge to share it with others. That's how you grow. And that's how you're able to be successful because you're helping other people. How do I use my cage code to get VA clients? Oh, E-Million. We had that full discussion. Okay, I'm going to tell you real quick. And then we're going to go. Your cage code does not necessarily mean that you're going to get clients. The first thing that you need to know is life coach. Hi, life coach. Yes, absolutely. We can work together. And guys, anybody that wants to do a one-on-one consultation, you can always go to my Stan store and you can grab my link and I do an hour's consultation. I would love one day, that we all get on and do a Zoom together so I can visually see everybody. But whatever you guys need to get to that next level. Life coach. Hi, life coach. Just send me a DM. Thank you for the heart knees. Thank you for the heart knees. Lista, Lynn, please. I don't understand what you mean. Lista, Lin, please. Hello, Dan Flo. How are you? Hi, Tenthong. How are you? I don't understand what you're asking me to list. The link. Which link, sweetie? Which link do you need? Tell me which link that you need. That's for the information. Caregiver. Thanks for the... Oh, you're welcome, guys. And guys, I'm going to try my information. Just DM me. Oh, my link is in my bio. But guys, I'm actually going to go in and I'm going to discount my consultation call. So if anybody that's going to go on there, just give me, my consultation call is $87. But for this evening, for anyone that's on there, I'm going to drop it down to $20. Okay, because I want to talk to each and every one of you guys. Are you giving a free ebook? Yes, I do have a free ebook. Yes, I do. If you go into my link and look on my Stan store, it says, what's the name of it? How I went from 0 to 1.1 million in 7 months. So yes, I do have a free ebook and it tells you my story and it gives a lot of information. But guys, this is the way. Let me tell you something. If you don't have the money, like I said, I'm going to go in and I'm going to drop the price to my consultation call for $20 for an hour, for 24 hours. And it's for everyone in this chat because I love you guys so much. You were talking about how to use the cage code to get my class. Okay, one more second. But wait till we get off this link, off this call, so I can go in and I can change the price for you guys. And it's an hour consultation. We'll have it over Zoom. I'll go over everything. If you guys do not have the money to pay for a consultation, this is what I'm going to tell you to do. Send me a DM, okay? The day before or that day and tell me what you want me to discuss on the Zoom. Someone just signed up for my free ebook, How I Went from 0 to I have an upcoming event and I'm seeking affiliates, but do you have an email address? I wish I can type. I don't know how to type. This is only my third live. Okay, everyone, life coach, send me a DM. Send me a DM. Someone else just signed up. Betty, is that somebody on here? Somebody else just signed up. How I went from 0 to 100. That's right. Get that free ebook. Is this a group Zoom or no? It's an individual Zoom. It's an individual. You're paying for it. Of course, it's going to be an individual. Matter of fact, you. Oh God, I almost thought I lost y'all. Wait a minute. Oh, you guys is getting that ebook. That's what I'm talking about. Go grab that ebook. Let me see if I got my Stan store on here and I can change it real fast. Oh yeah, I can change it real fast. Hold on, guys. Hold on, store. Let me see. Hold on, guys. I'm gonna do it for you right now. Edit product. Okay, publish. Okay. All right, guys, for 24 hours, showing you right now, I just did it. For 24 hours, I have book your one-on-one call. I just made the price $20. Now, my partner's probably going to kill me, but that's okay. For $20, guys. So go ahead and book your one-on-one appointment. It's going to bring you a calendar link. And we'll go from there. Any advice for New York? Oh, New York, you guys are going through a lot right now. What my advice for New York is to market, and to follow up with people. Thank you very much for following me. Follow up with as many people as possible that you can. Dizzy, how are you? 9 Medical. A lot of people are coming onto the chat, guys. You really need to in New York, because they're trying to change the laws in New York, and they're trying to have it that is being, guys, tap them hearts. We're going on an hour and 40 minutes. Give me some energy. I'm starting a non-medical in New York. Yeah, New York. Oh, thank you, Dizzy, for the love. Thank you for the roses, guys. This was so exciting to me, guys. We absolutely had a fabulous time today. And I'm going to, what's tomorrow? I'm on here. Oh, thank you for the Join Me Club. Thank you, guys. I'm going to be on here every night. Madison Takeover, thank you very much for the fan club. I'm going to be here every night at 7 p.m. except for Thursdays. Okay, Florida, we got Graceful. We got a couple people in Florida. And guys, I want y'all to talk to one another. If you guys, before we leave, everybody put what state you're in. So you guys know what state each other are in, and y'all can talk to one another. Y'all can work with one another. When you guys get your MCOs, everybody is not going to have the same insurance. Have somebody that you got Aetna and Blue Cross. You got UPM and Keystone. You guys can share with one another. That's right. Get them states going. Life Coach, you're in Florida and New York. I absolutely love it. Florence just got another ebook. Very good. South Dakota, awesome. You guys did an awesome job. Awesome job. And I'm looking to talk to, whoever can book that consultation call. Let's get on the phone. Let's talk. Thank you, Life Coach, for the heart me. And let's get you guys businesses going, because it is the money out here that we can make. This industry is worth between $450 to $650 billion. Everybody on here can be making 7 figures. And guess what? It's easy. When I tell you it's easy, it's easy. And, you guys are going to find out when I'm working one-on-one with you, your business is my business. Your success is my success. If I help you get 5 clients in 30 days, you know what you're going to do? You're going to come on this live and you're going to tell everybody what Rob and Michele did. All right, guys. You guys have a good evening. Everyone, let's throw these hearts up because I'm about to go. Thank you very much for you guys coming on. If you need me, DM me. Just give me about an hour to recuperate, and then I will respond to everyone. And everyone have a good evening, and I will see everyone back at 7 p.m. Thank you, everyone. Thank you. Okay, thank you. And Graceful from Florida, make sure you DM me. Live Coach, make sure you DM me. Anyone, you guys have any questions, DM me. God Digital with me. Go digital with me. Okay, go digital. What are you into? Digital marketing? Okay, Betty. Thank you, Betty. Thank you, guys. Have a good one. Good night, everyone. All right, good night.